Hey there, good morning. So this morning we're going to have an interview with Justine Calderwood, who's in Colorado, and she'll be talking a little bit more about managing chronic pain through myofascial release, education, and self-care. And she's here, so let me just bring her on. And in the meantime, if you are interested in being interviewed or you know someone that's, good morning, Justine.
Good morning.
If you yourself would like to be interviewed or you have a recommendation of someone that would like to be interviewed, just comment below and refer them or let me know their name. But for right now, I'm going to talk a little bit about Justine. So I'm going to give a brief bio here, Justine, and then we can get started, okay?
Okay.
All right, perfect. So Justine is a physical therapist, a holistic physical therapist at Healing Spot Physical Therapy in Woodland Park, Colorado, which I would really love to visit at some point. And she is passionate about helping women and men with chronic pain feel better and move easier to recover from trauma, injury, or life circumstances. Justine helps adults discover the hidden clues to their physical pain, unravel the kinks, and guide them towards authentic healing, regardless of how long they've been suffering, which is very optimistic because sometimes if they've been in pain for a long time, you and I know that sometimes it can be a little daunting to think that they can actually heal again. Good morning, Sophie. Beautiful. Anything you would like to add to that bio?
I don't think so. I mean, that's primarily what I do is I help a lot of people that have been in pain for a long time. But again, it doesn't matter how long. I mean, I see people with acute pain as well that just started. But majority of what I see are people that are dealing with pain for weeks or even years. And it's amazing the body's ability to heal. And I'm just always amazed every day when I get to be a part of that.
Yeah, beautiful. Good. So what's your areas of expertise, you would say? Is it chronic pain?
Yeah, chronic pain, I would say majority of what I see, probably 80% are people with low back pain, and then neck pain or headaches. And then the other 20% lies primarily in, other joints or maybe even multiple areas of the body. And then I'm also doing women's health. So people that have with pelvic pain or issues after childbirth, like incontinence and prolapse and things like that, women specific. So yeah, it's always exciting to see people.
Yeah, that's really important because I think sometimes we don't know that we, can actually talk to a healthcare provider about those things, especially after childbirth. A lot of times we're just sent home from the hospital and we're like, see you, good job, good luck.
Yeah.
But it's good to know that there's professionals that specialize in this area, and it's important to take care of yourself. So how do you incorporate wellness into your business model?
So I really try to do a lot of education with people. I mean, like you're saying, a lot of people don't even know, women's health particularly, they don't know that physical therapists can help them because maybe they're not being told by their OBGYN or doctor or whatever. So I'm really trying to get the word out there that, hey, this is available. So one is just education and trying to get them, educated before they have a lot of big issues, and also encouraging people to, their friends. But so yeah, education, and then empowering my patients to help themselves and really letting them know that the body does have the ability to heal. And it doesn't necessarily need, medications thrown at it or injections or unnecessary surgery. So trying to get the word out there, I would say that's the biggest thing, and helping people listen to their bodies. So, just giving them hope. I've had people that, I've talked to that have come in that have big things that they want to do. And big by, I had a lady that wanted to ride her horse and was told she was never going to be able to. And, yeah, and after the first couple of visits, she asked me if she would, and I said, I never give up on the body. I don't have that crystal ball, and anyway, she ended up seeing me for like 12 visits. She's back to riding her horse, and had I, not given her that hope, her outcome
Mm-hmm.
would have been completely different.
Yeah, I totally agree. I have a story that when I was recovering from my wrist surgery, so I was about 20 and 21, the surgeon said not to start a career that uses my hands or else I'm going to have arthritis when I'm 25. But here I am
Yeah.
because I chose not to believe it. But if you have a story like that where a healthcare provider maybe on good attention just because they didn't want to give you false hope,
Mhm.
but kind of burst your bubble in a way in terms of putting a glass ceiling on your healing, leave it below so we can support you. Like Justine said, the body has a really innate ability to heal. We are all have this inner blueprint of our own best health and wellness, and that's what we're here to help you discover and unravel that. So leave a story, ask a question. If you have any comments to this to add, please share. We'd love to hear it. So how do you recommend to your patients and clients to incorporate self-care and wellness into their lives?
Yeah, absolutely. I do. And I also look at, like I said, I'm more of a holistic. I look at the body, not just as a body. Nobody's just
Mm-hmm.
walking in with joint pain or I have back pain and that's all I'm looking at. So I ask, a lot of questions that look at, from do you have a healthy life balance? But I'm looking also at their mental, health too, not in the capacity that I'm like, overstepping
Right.
boundaries, but at least acknowledging that. And that's part of what's in my intake form. So that, if someone's dealing with a lot of sadness or a lot of big issues and stress, I can refer them on to the appropriate provider. And then also, a lot of people bring up spiritual things to me as well. And, if someone's really struggling, I don't have a problem referring them on as well to a spiritual counselor or advisor. And so just kind of looking at all of that and how that plays into, especially with chronic pain, because it's all makes up, who we are, and you can't really separate that out. I do in my treatments and with patients, I use essential oils as well. So I do a lot of hands-on stuff, a lot of education on what they can do at home. I'm incorporating essential oils, for like aromatherapy, but also post-treatment to help just support the body and the mind and create kind of this environment that is more healing. And when people step into my room, I want it to be, hey, this hour is for you. This is for you to take care of yourself.
Yeah.
Leave everything outside the door because it'll be there when you get done, but hopefully you'll be in a better space to, address it or deal with it.
Yeah, you create a safe environment, a little safe zone for them to, release or let go or build strength, whatever they need.
Yes.
I incorporate the oils too. I love adding it to their home programs so they can have a little bit of independence when they leave my door. They're like, oh, I have tools that I can use that's, not like pain meds that's going to have these dire consequences and side effects, but they can have items to boost their health and wellness and whatever else it may be, improve their mobility, that sort of thing. So I love using them as well.
I was going to show you too. I give like a little inflatable ball. It's got my logo on it, so it's good for my business. But it's really to give people that first visit. If I'm talking about how to use an inflatable ball into certain areas, very specific to what they need, but I can then give them this tool. It's included in the price of the first visit. And I say, hey, this is what I want you to do with the ball. So it's just empowering them and giving them something specific. When I started out as a PT, I think I overgave exercises and stretches. I was so excited. I wanted to help people, and I probably overwhelmed a lot of people. So now I really try to stick with maybe one or two great things to get started with, and because I know we're all busy. But this is a great tool, and I teach people how to listen to their bodies too, because I think that's super important. That they're not just relying on me for those answers; that they really do have a lot of answers that they can be aware of as well.
Yeah, it's so important. So keeping it simple. So how many of you have been to a PT or chiro, acupuncturist, or their own MD and have been just walked out the door in complete overwhelm? I think as all healthcare providers, this is something that we can learn from. I myself am learning it as I teach trainings. I keep reminding myself, less is more, less is more. But back to that ball, Justine, what can you share with us? One tip you would recommend to do with that ball?
Oh, a great tip I think everybody needs, because how many of us are on our phones like this or on the computer sitting? A great way to use it, I'm just going to turn my chair here, is just,
Sure.
this chair doesn't work super well, a little bit higher back chair, but putting it between your shoulder blades and leaning back, it reminds you to bring, open up your shoulders. It'll release from the chest, because a lot of people have pain in their back and their necks because, believe it or not, because of tightness and issues going on in the front side. This can also be used just lying down on your back. You place it either on your bed or the floor. And again, just put it between your shoulder blades, bring your arms out to the side and let your head tilt back, and it just gets all into that chest and the front of the neck. And it feels really great. So
yeah, as we yogis say, reversing the slump asana, right? So how many of us could use a little ball? Raise your hand, leave a comment below. Great. So as a business owner, what do you think your biggest challenge that you've had to overcome for yourself has been?
I didn't realize going into business how much personal growth I would have to do.
Yeah.
When you start, trying to promote yourself and how you can help people, and you're the one having to tell people that. I didn't have anybody doing my marketing when I started out. So you get, it was right in my face, what I didn't feel comfortable with, what I was self-conscious of, what I was afraid of. And I really it was either, okay, address this and push through it and find a way through it, or you're not going to be able to do this. And I didn't want to give up. So yeah, a lot of personal growth, finding the confidence to just keep going forward and putting myself out there. And I'm going into my third year of business, and it's still challenging a lot of the times, but it's easier than it was.
Good.
So yeah.
Yeah, they say if you plateau in your business, the reason why is usually yourself. So you need to look within. So I'm personally learning that myself as well. And it's been a really interesting and rewarding journey for sure. How do you incorporate wellness into your own life?
I take the time to do the self-care that I teach my patients. I've discovered my own restrictions, and just taking care of myself, not just physically, because again, I know the importance of looking at everything, the mental wellness, spiritual wellness as well. So really just taking the time, whether that be in the morning and getting up early, or at the end of my day, throughout my day if I can, but taking the time to use my little ball. You'll find me using them, maybe meditating, spending some quiet time, just decompressing. I use other self-treatment tools as well, but I really try to practice what I preach, because if I'm trying to tell people to do this and I'm not doing it, it's not congruent.
Right.
Yeah.
Living the authentic life.
Yeah. Yeah, and eating right, just incorporating everything, trying to eat right. I'm not perfect, but trying to eat right and go to the gym and just, have that downtime as well.
Yeah, good. Working all these different facets. So how many of you are healthcare providers or yoga teachers or wellness coaches that, sometimes really lack the time to take care of yourself? So this is a really important reminder that if you fill your cup first, then you're going to have more to give to others. And I for sure realize that when I'm not filling my cup, my treatments don't seem to carry that same weight or quality. So it's number one on my list every day for sure. But I've had to learn the hard way, unfortunately, first. I guess you live and you learn. So Justine, any parting wisdom here as we close up this interview for today?
I just think just taking time. I think just expanding on that, taking time for yourself, because that's, especially I think as women, a lot of us, we feel guilty of that, taking the time, because we should be caring maybe for our families or our spouses.
Right.
Whatever, there's something to do. And my husband's great about reminding me that, Justine, your business is always going to be there. I know you're passionate about it, but, we need you here too. So just taking that time for yourself.
Yeah, exactly. Because the to-do lists are always going to be there, and they're going to continually be adding items to it. So first replenishing yourself, and then you'll have energy to cross things off the list in the future for sure. Great. So Justine, what's the best way for people to get a hold of you and contact you?
You can find me on my Facebook page or my business page at Healing Spot PT, or my website is healingspotpt.com. I'm on Instagram at Healing Spot PT, so it's pretty easy. Those are the best ways to get a hold of me. Send me a message or look up my phone number or whatever. So I'm pretty active on media. So yeah.
Good. Yeah, and when we finish, you can always leave your website and any of the social media information in the comments below. And so you guys will have that access to it, and you can reach out to her, even if you're not in Colorado. I mean, essential oils is something that you can work pretty much anywhere in the world with. So you can always reach out to her, which reminds me, we're actually, Justine and I and a few of our other team members are hosting an essential oils class on Facebook tomorrow night at 6:30 p.m. Pacific Standard Time. And this is huge because we're giving away a premium starter kit. So you can see the diffuser behind me. So you get one of those plus 11 oils, which I don't know, for me, they're the ones I pretty much use every day. And you don't have to be live to join the class. You can take the class, comment, participate anytime before Sunday, and you have a chance to win the kit. So if you'd like an invite, you can reach out to Justine or me or leave a comment below, and we'll get you in the class. Great. Well, it was so much fun to learn more about you and your business. And now I have a little great tip with that little ball, because I actually have one of those balls, and I don't think I utilize it enough.
Awesome.
But yeah,
it's very useful. I teach classes with it as well, and a lady just joined a class of mine that I'm giving tomorrow on how to use it because she saw one. She said, I couldn't find one anywhere on Amazon or anywhere. I mean, they're pretty easy to find. Mine's kind of special, but I mean, you can go to Walmart, has them, and Dollar Tree and that kind of thing. So yeah.
Yeah, my daughter steals hers. She thinks it's her ball, but go ahead. She's 2.
Yeah.
Great. Well, we'll close up for today. If you guys have any final comments or questions, leave them below, and we'll look through we'll scroll through the feed in the future and get back to you. And again, if you would like to be interviewed, or you have a friend that would like to be interviewed, just leave their contact information below or send me a message and introduce them, and we'll get them on here live. So I hope you all have a great day, and I look forward to seeing you next week. Thank you so much, Justine.
Thanks, Allison. Talk to you later.
Okay. Yeah, bye.
Bye-bye.
Ah.